Coming of Age is coming up next. I'm your host, Emily Echeverria. Today we'll be getting an exciting update on the new, soon-to-be-open Baptist Hospital campus. Next up, we'll be talking about a survey that will allow older adults to voice feedback and concerns about our community and how you can take part. Finally, we're visiting the West Florida Public Library to check out the current slate of programs and activities for the late summer and fall. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's wide range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll find the support and connection that you need to age well. Aging looks different for everyone, and we're here to help you meet your needs and thrive while maintaining what makes you, you. We've been in the community since 1972, advocating for elders and supporting those who care for our parents and grandparents. Now, join us as we discuss the age-related issues that matter to you. Baptist has been building a new main hospital at the intersection of Brent Lane and I-110 in Pensacola, Florida. This new facility will keep us close to our current main hospital location and will offer greater access, enhanced technology, and a concentration of related services, making it easier and more convenient to deliver better care to those we serve. We expect to open this new hospital in the fall of 2023, and we have Baptist Healthcare President and CEO Mark Faulkner here to tell us more about this new development. Thank you for joining us to talk a bit more about this new campus.
Pleasure.
So this new Baptist campus will include more than just a hospital. Can you tell me what all will be on the campus?
Sure. Yes, it will include as its anchor the new Baptist Hospital as we relocate from the current campus on Ian Marino Street to Brent Lane. But in addition to that hospital, we'll also have a medical office building that will house many of our physician practices and outpatient services. We'll also have a replacement behavioral health unit, a freestanding behavioral health inpatient unit there. And then finally, we'll have a fourth building, the Henderson Health Building, that'll also hold physician offices and outpatient services as well.
Okay, and can you go into a few more details about the new Baptist Hospital?
Well, we're excited about all the progress we've made over the last couple of years since we announced that we were moving. And I'll start with the hospital itself. It's a 10-story, 264-bed facility. And it will replace all the inpatient services currently at the existing campus. In addition to that 10-story hospital, it's about 600,000 square feet, we'll have the Bear Health Center, which will house, again, all of our outpatient services, including 162 physician exam rooms, all of our clinical and outpatient services. It's about 180,000 square feet. And then the behavioral health unit will be a 72-bed unit that will accommodate pediatrics, adolescents, adults, as well as geriatrics. And then finally, the Henderson Health Center, which is about an 80,000 square foot facility for physician offices.
Okay. What more can you tell us about the Bear Family Foundation Health Center?
So it will be there, again, to accommodate what's mostly in the towers today downtown, physician offices that are multi-specialty, primary care. We'll have our cancer services, our heart and vascular services, lab and imaging, as well as a large community conference center as well.
Okay. And how are these facilities enhanced for safety, quality, efficiency, and patient experience?
Well, it's sort of a gift to have a clean slate to build upon and a blank canvas. Hospitals, they grow and they evolve over years, and certainly the main campus, which has been in existence since 1951, has grown and evolved over many years. The opportunity to kind of build it from scratch, to co-locate like services, to make wayfinding very simple, all new technology, state-of-the-art imaging and other technology. It's designed to bring in more of a healing environment, a comfortable healing environment that has natural lighting. It's there to accommodate inpatient and outpatient services as well. And then finally, it is built to be resilient. As you look at Hurricane Michael, Hurricane Ian, when healthcare gets knocked offline by storms, when it's needed most, that's when we need to be most concerned. And so we're building this facility to be resilient in common weather events and the like as well.
Absolutely. What will the new campus experience be like for patients, visitors, and the community?
It'll feel anything but like a hospital.
Mm-hmm.
It won't, hospitals are cold and sterile. This is a very warm environment. Again, a lot of natural lighting. We have equipped it and decorated it with a lot of local themes from history, downtown, our beaches, our rural areas. And it just really will feel like a more natural home environment. And in addition, we'll have what we call the town square, which will be centered around this beautiful grove of live oaks, a lot of walking spaces and paths, places where you can go and just kind of clear your mind.
Awesome. How will this campus improve healthcare and access in our community?
Well, sometimes minutes matter in trauma and the like, and so certainly being on the interstate there in Brent Lane, the two major thoroughfares, will increase visibility and accessibility in those critical moments as well. We're only moving about 2.5 miles from our current campus, but yet we're not only still accessible to those neighborhoods, but we're much more accessible to the broader community. In addition to being accessible, we are equipping it with all new technology, state of the art. Everything will be state of the art. And so that in and of itself will bring a whole lot of advancements to our community.
And what else distinguishes this new campus?
Well, again, it's really designed with the patients in mind and even our team members in mind, to make it simple, to make it more of a comforting, healing environment. It's built for growth as well. Hospitals, when they grow and expand, they become a labyrinth and a maze, and wayfinding gets very complicated. This is built to grow vertically and horizontally in very simple, intuitive kinds of ways. I mentioned the outdoor space that will again create a dramatic healing environment. I think also it's different because the way our community has engaged in this process. We have been thrilled with the reaction and the responses from our community, the excitement about opening this campus pretty soon, even to the tune of almost $15 million of philanthropy has been raised to support this mission as well.
That is awesome. So how will this relocation be managed? It's a huge endeavor.
Yeah, not many people have moved a hospital before, and we're about to undertake that very soon. We've been, as you might imagine, training for months and months and preparing for this upcoming move. The move will take place in one day. We'll start that morning at 6 a.m. We'll begin moving our most critical patients, and then we'll finish by that afternoon. And by the end of that day, all of our staff and all of our equipment that's going, as well as all of our patients, will be relocated to the new campus. And then the following day is when we'll relocate all of our offices and outpatient services as well.
Wow, a huge logistical undertaking. When are you moving?
So right now we're scheduled to move September 23rd. We've actually circled that day for well over a year, and we're on schedule, we're on budget, and as I said, a lot of training is going on, including simulated moves, tabletop exercises, and we're certainly working with our EMS partners. They've been phenomenal as we'll work closely with them. We'll have 15 ambulances on that day going all day long in caravans moving inpatients from one facility to the next, and it will be a logistical challenge, but our team is well up to that.
That's great. So how can the community stay informed about the new campus and the progress?
I would encourage them to go to ebaptisthealthcare.org, where we are constantly updating that website with new photos and videos and messages, as well as we look forward to the move-in day.
Perfect. Thank you so much for sharing this information with us.
Thank you for having me.
Stay with us. We're talking about the Community Assessment Survey for older adults next.
If you're looking for a fun and exciting environment for your loved one, then L&L Executive Adult Daycare is a perfect fit. We offer social gatherings, physical activities, games, outings, and daily luncheons from Karen's Catering. We take a holistic approach to social stimulation and aim to enrich the lives of our guests. Let us help restore your loved one's mind, body, and soul. We'd love to speak to you. L&L Executive Adult Daycare. Big business love with small town feel.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference. The Beacon at Gulf Breeze offers the finest senior living community in the area. We are here for your loved ones who need assisted living and advanced memory care services. Seniors will feel right at home with studio, one-bedroom apartments, a large dining area, a beautiful landscape courtyard, and even a salon. With professional staff and one-on-one care, your loved ones are our top priority. Welcome to the Beacon at Gulf Breeze. Welcome home.
Older adults ages 60 and up in the 4-county area have an opportunity right now to make their voices heard. How? The Community Assessment Survey for Older Adults is a survey that collects response information on livability factors for seniors, and we need your candid input if you are over 60. This survey is being facilitated by the Northwest Florida Area Agency on Aging, and we have Kathy Irons here with us to tell us more about this effort. Thank you for being here, Kathy.
Thanks for having us.
So what is the Community Assessment Survey for Older Adults, or CASOA as we call it behind the scenes?
Yes, thank you. The Community Assessment Survey for Older Adults is a needs assessment survey. So it is basically the first step in a planning process that we do every 4 years. And it measures 6 dimensions of community livability and overall quality of community for aging residents. And so our service area includes Escambia, Okaloosa, Santa Rosa, and Walton counties. And we want all aging adults 60 plus to log on to Northwest Florida or nwflsurvey.org.
And why is it important for our community to get this data about livability from the perspective of older adults?
It not only compares the results to national measures, but it also, our aging population is growing. And currently all of the programs and resources we have in place are based on old information, or what we can call anecdotal information. And this gives us a chance to really listen and dive into what our community members are saying they want and need.
Absolutely. So tell me about the process of gathering this data from a random sample, and who does that affect?
So there were 1,500 residents in each county, so 6,000 total. And our survey company, POCO, mailed out actual mail-in surveys, if you will. And the residents that received those surveys, it was a scientific algorithm to ensure it was random. They could either respond via mail or on a survey website. And so that data collection is in process, and now we've simultaneously launched open participation for anyone.
So for that random sample, those are out, people have received them.
Yes.
And if you receive something in the mail from CASOA, from the Community Assessment for Older Survey for Older Adults, then go ahead and do that survey. And then after that random sample, now we have the open survey period. So what is the purpose of this, and how can people participate?
So the purpose is to give everyone a chance to voice their opinions and participate. You know, I don't know if you've ever been a victim of someone making a decision for you when you weren't able to provide input. And so we want to make sure that everyone who wants to give input to aging services has the chance to do so.
And what are the dates for that open survey participation?
It is live now, started August 1st and runs until August 21st.
Perfect.
So anyone that receives something in the mail has their own special link that they should follow, but all of our open participation residents have until August 21.
Excellent. So how can our community use this data that is collected through this process?
So we are government funded, and this is a great way to collect the evidence needed to campaign for either new programs, more funding support. You know, how can we better support the Council on Aging to help us carry out our mission? Anytime you're looking for more funding from anyone, you've got to have evidence.
Absolutely. And what's the role of the agencies like Council on Aging in getting this data in the community?
Well, I think anyone who's ever been in social services knows we are small but mighty teams. Everyone in the business, if you will, is very service oriented. However, none of us can do the job on our own. And so we rely on the Council on Aging and all of our providers and advocates and volunteers to really canvass our service area. We not everybody uses social media, or, fill in the blank with whatever example. So we really try to communicate using all of our resources, and definitely our primary resource is our local providers.
Absolutely. And so what are the big takeaways you want people to know about the survey?
Well, first of all, August 21 is the deadline, so act quickly. It only takes about 15-20 minutes, and at the close of the survey, we will make all the results publicly available. So anyone who wants to see those results can get them from our website. Once they're published, we anticipate near the end of September.
Excellent. And what are some of the kind of community leaders or people we might share this information with who could use it?
Great question. So everyone from your local council person to city mayors, planning offices, and then it goes up from there to the state and county levels. So really great tool to communicate with all of your political leaders, if you will.
Absolutely. And what are some of you mentioned the kind of 6 segments that it asks questions about. What are the questions like in this survey?
So the questions are everything from, did you have any issue feeding yourself today? Or do you feel safe where you live? Do you feel like it's walkable? Do you have access to reliable transportation? So it really gets very granular into the day-to-day life of our aging residents.
So it is those activities of daily living, it's the community resources and support.
Absolutely. And it even asks about hobbies and social interactions, and do you know where to get information if you need help? And so it really comprehensive.
And can you give us that survey website one more time?
Absolutely. nwflsurvey.org.
And if people have any questions about it, who can they reach out to?
They can call the Northwest Florida Area Agency on Aging, the Elder Helpline, or they can reach out to the Council on Aging or any other service provider they're connected with.
Perfect. Well, thank you so much for giving us this information, and we hope that many of our residents share their opinions with us.
We hope so. Thank you.
Thank you. Up next, paging all book lovers. We're talking about what's going on at your local library.
Over 2 decades ago, TLC Caregivers partnered with the Council on Aging of West Florida to assist seniors with non-medical help to stay independent in their own homes. Our commitment to providing these services started in 1989 and has grown to aid people from birth through geriatrics. From a short visit of 2 hours to 24 hours a day. We're a proud sponsor of the Council on Aging of West Florida. We're TLC Caregivers.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
They call me Prince like I'm royalty or something. But the places I've lived ain't no palaces. So I don't need grilled salmon or a new scratching post. Just give me a cardboard box and a can of tuna and we're good. You can even change my name. I'm cool being the kitty formerly known as Prince.
Have you visited your local library lately? If not, it's definitely time to dust off your library card and see what's new. There are tons of ongoing programs and events at West Florida Public Libraries and some new additions to the lineup as well. We have Division Manager of Educational Services, Jason Neel, here to tell us more about what's going on. Thank you for joining us today, Jason.
Thank you for having me.
First of all, tell me a bit about your role with West Florida Public Libraries.
Well, as you mentioned, I'm the Division Manager of Education and Outreach. That also includes InReach. Any of the classes, groups, events, anything that we take to other schools or places, that kind of goes through my office and stuff. So it's very busy, a lot of stuff going on. We have 7 libraries in the system, starting from Southwest to West Side to our downtown Pensacola branch to Tryon, then over to Bellevue and Molino and Century, all up the county.
Awesome. And a lot of people think of the library and of course think about books, but you have so much going on. What are some of your late summer and fall programs looking like?
Well, we were starting to wrap up our summer reading program that was very successful and stuff. We're going into fall with a real big focus on our STEAM activities, and as some may know, that's science, technology, engineering, arts, and math. We focus a lot of our programming for the kids around that, so we have STEAM story time coming up. Yesterday we started our Ozobot program, which is teaching kids to program with these tiny little robots. We started that at Westside yesterday. Wow. So those events are what's going to be coming up for the kids and stuff here in the fall.
Okay, so a lot of new kind of educational things going on as the school year gets started.
Educational stuff, and we also have our 1-year anniversary with Bellevue opening up in September, so it's going to be like a little birthday party there. Molino's going to have a little festival for October. So again, each library has some consistent programs going on, but we try to make them more specific for the area that they're in and stuff. So we have a lot of things going on to check out.
Excellent. So something kind of different going on at each of the 7 branches.
We try to meet our patrons' needs and really reach out to the community.
Excellent. What are some of the programs or activities you have that might be of interest to our seniors, our older adults?
Well, a couple things we have, some health and wellness stuff. We have chair yoga. We also do Tai Chi. At our Tryon branch, we're really starting to promote our sewing and quilting out there. I'm getting ready to purchase a long arm quilter that'll be put in there in the fall, so people will be able to do up to king size sheets and quilts and stuff. We'll teach classes on that, or if they have a project that they want to bring in, they can also bring that in as well. One of the things that seniors might be interested in is technology classes. So we'll have basic computer, cell phone, cybersecurity. I'm actually teaching one on iPhone basics at Bellevue coming up this month. So a lot of technology classes that people can join in and sit in on.
Excellent.
Yeah.
So anyone who's feeling like they need a little refresher or need a little lesson there, they can come in and go to those classes?
Exactly, and they're structured, but at the same time, I keep the classes organic, that if people bring up questions and stuff, we're not set on a schedule. We can always kind of bounce around and meet needs that way.
And do people need to register, or can they just show up? Is there a fee?
Everything is free at the library. There's no fees for anything. And as far as showing up, we just encourage them to show up. We've tried to do some sign-ups before, but we just like to keep it open and anybody can come in when they want to.
Excellent.
Yeah.
We have a lot of seniors in our community that are raising their grandchildren. So what are some activities that are going on at the library coming up that maybe grandparents would want to bring their grandchildren to?
Well, like we mentioned before, the STEAM story time, any of those that are coming up at all the different branches, it's a story time with the book, of course, and then it's tied into a technology lesson. So they'll read the book and they'll go into a lesson. And then we have our actual STEAM classes that are coming up, again, with robotics and stuff. We'll have no-sew pillows, little fun activities like that coming up in the future and stuff. Tie-dye shirts, all kinds of little things that grandparents can come in and enjoy with their grandkids and stuff. Awesome.
Tell me about the Library of Things, because you had mentioned that now the library is doing this.
I'm very excited about the Library of Things. It's a non-traditional offering. Some libraries do, some don't. A lot of times people think just books and magazines, periodicals at the library. We're providing things such as a bocce ball set, ukuleles, toolkits. I'm wanting to introduce specialty tools that you might need for a car that you don't want to buy the whole piece of equipment for, but you can check it out. Coming up in the fall, I like to buy some food, cooking utensils, that kind of thing, like a bread making kit. So the Library of Things is a growing group of items that you can check out through our catalog using your library card, and all of it's free, and it's just kind of a non-traditional offering. One of the examples fishing poles. You can check those out from Bellevue if you wanted to. So that's our Library of Things, and it's always growing.
So how does that work exactly? Are there different things at each library? Is it like a book where you can place a hold and then can pick it up?
I'm glad you mentioned that. Coming out this month, I've got one of my staff members, she's putting together a brochure on the Library of Things for each library. So when you come into the circulation desk, you can actually see what's in that library to check out, or you can look on the back of the flyer and see what's at other libraries. There's also going to be a poster form of that out and stuff, and basically they'll have that at the end of the month. If you have an idea of what you're interested in, you can always search these items on our online catalog through our website at mywfpl.com, and you can look up the items that way, check them out with your library card, and again, everything's free.
Awesome.
Yeah, it's cool.
And so a lot of people are doing audiobooks now. Tell me about how the library does their audio resources.
Our biggest audio resource right now is what's called Libby. There's an application that took over Overdrive. Some people are familiar with Overdrive. A lot of libraries around the country use the same system. They've gone to Libby. It's a little bit different format, but it's all basically the same. You download the app on your from the App Store, install it on your device, tablet, phone, that sort of thing. Once you open the app, you follow the prompts, find your library, enter your library card in, and from there you've got audiobooks, you've got digital magazines, digital books, and from there you can read, check out, read stuff like that. If you feel comfortable with Bluetooth, you can tie audiobooks into your car and listen to these on the way to work, that sort of thing. So Libby is the main thing that we have for our audio listeners and online readers right now.
Excellent. Cool. And that's a fairly streamlined process, downloading the app and then putting in the prompts for
It
that.
is, and it can be kind of daunting for some, so just pop into any of the libraries and anybody would be happy to help you. We have great staff that are very friendly, and ask a question like that and they'll show you how to use it.
Excellent.
Cool.
One last thing I do want to say about the library, all the programs, activities. Council on Aging does come to the library on a monthly basis at Main Branch and Tryon Branch. Anybody who has questions about services or if they're a caregiver, they can come up and ask us. And where can they check to find out the times of that, the exact times, and look at the schedule of all the events at the library?
We have so many events going on. They can go to basically mywfpl.com, that's mywfpl.com, or they can go to the West Florida Public Library's Facebook page. That's our two main sources of information that'll have all the dates and times there for these wonderful events.
Excellent. Well, thank you so much for joining me today and letting us know about all these programs.
Thank you for having us.
And thank you for watching. Until next time, enjoy life. You've earned it.